talking about the anatomy of movement, we're going to be going down to the hip joint. And the hip joint is one of those ball and socket joints that has a whole lot of mobility. So I'll start here in anatomical position. You're going to notice, I always find it interesting what people think of the concept of hip distance apart for their feet. You'll find all sorts of things of people getting really narrow or really super wide, but your hip joint is just slightly off of the sides of your body. It's a little bit deeper from the lateral aspect of what we think of as the hips or the side of the body. The hip joint's in a little bit, so we want to have this line straight down through the knees, through to the ankles there when we're standing in neutral. I tend to practice mountain pose like that rather than having the legs completely squeezed together, just because I feel like it's a more neutral stacked position, especially for women who have a slightly wider pelvis than men. This helps to create that stacking feature in the joints, and in the long run can help us to save some knee problems. So here we are in anatomical alignment, and I'm going to try to isolate the hip joint. We'll see how my balance does with this, but I'm going to go into hip flexion. Okay, so hip flexion, right from here, trying to keep the rest of my spine neutral, is going into the front right there on the sagittal plane. So if I had a sagittal plane splitting my leg into a left and right portion, I'm moving up on the sagittal plane. This is flexion. I come down into neutral, and going behind me is extension. All right, and my pelvis kind of wants to follow that a little bit as I come up. If I go into a posterior pelvic tilt, I can get the leg higher. And then as I go into hip extension, I go into an anterior pelvic tilt to get a little more extension there. So you can see it's kind of like the lower back in the pelvis. The joints on the top and bottom of the pelvis are going to be directly influenced by that movement. So hip flexion, hip extension. Okay, and my note about this is side bending. You can do, or not side bending, forward bending. In forward bending, you can come at it from a space of flexion in the spine, flexion in the vertebrae. So if I do a roll down, I'm going into flexion with the cervical spine, flexion with the thoracic spine, flexion with the lumbar spine. My pelvis tilts anteriorly, and I'm down at the floor. And then I can roll up the other way, tuck my tailbone, and start to stack the vertebrae as I come up. All right, so I went down into spine flexion. Now I'm going to go down purely with pelvic movement. I'm going to keep my spine totally straight, okay, and I'm actually moving my pelvis, but I'm going into hip flexion because instead of my leg coming up toward my torso, I'm just going to be moving my torso down toward my leg, and it goes both ways. The end point of the movement is going to be hip flexion either way. All right, so keeping my hands on my pelvis, my spine stays pretty still, and I move down into 90 degrees of hip flexion. So you can see that angle is happening from the joint right here. And then I'll come back up. Keep that in mind when you're doing forward bending, especially for people who have lower back problems. If they do a lot of lumbar flexion as they go into their forward bend, it can aggravate their back. But if they hinge from the pelvis and from the hip joint, it's a much more stable position in here. It's going to be a safer way for them to access forward bending and feel like they can participate in forward bending, but without aggravating an injury that happens somewhere in their spine. All right, so that was hip flexion and extension. And we're going to go into hip abduction and adduction. It follows the arms, makes it a little bit easier. So abduction, abduction, we go out to the side. You're going to feel those muscles on the outside of the hip firing pretty well. Adduction, I'm going to swing it down past my center line. So I'm adding it toward the center, or I'm taking it away, right? So abduction, abduction, and then adduction. If you're sitting with your legs crossed, you have adducted your hip, or if you're going into eagle pose, you have a really strong adduction of the hips. There's also some hip flexion, some knee flexion, other stuff going on there too. but just isolating that movement at the hip. Okay, flexion, extension, abduction, adduction, circumduction. We can do some nice circles with the hip. If you're down on your back doing leg circles, or if you're in table doing knee circles, then you're just using knee flexion, but you're still circumducting from the ball and socket joint at the hip. Also a nice way to work on your dynamic balance. But when we start to talk about rotation, it gets tricky, right? The shoulder rotation, a little bit tricky. I would say rotation at the hip is a little simpler because we don't have that overhead factor coming in to complicate this. But I'm going to start down on the mat to show you external rotation, because this one is what we do the majority of the time in yoga. We're usually externally rotating. So I'll come into Supta Konasana. Okay, here's my hip. It's in neutral rotation, straight forward. Now think about the ball joint right here, and it's going to roll laterally, okay? Rolled it out to the side, and I'm going to do the same thing with this leg, roll it out to the side, join my feet together, and there's Supta Konasana, externally rotated legs. The pose that I love to use to counteract this is internal rotation, which we hardly ever do in yoga. There's just not as many poses where we internally rotate. I'm going to walk my feet out toward the sides and drop my knees in toward the center. The sensation here is different. It's this wrapping around from my lower back around the outside of my hip joint. But this does really nicely for me when my lower back gets tight. I like to do this if I'm sitting for a really long time. I like to do this pose. But think about creating balance in the hip. If we're constantly stretching an external rotation, then we're going to get imbalanced with our internal rotations. We want to throw this in every once in a while. Walking back up to center. If I'm going to do a figure 4 stretch, my knee rolls out to the side and I'm going to pull it in. Okay, so I'm going into some hip flexion, external rotation. There's some knee flexion going on here. And then release that. Okay. Let me show you rotation from a standing position too. So it always makes more sense when you come back to anatomical position. The feet can serve as a guide, right? Just like when we did the shoulders, my hand can serve as a guide of whether I'm internally rotating or externally rotating my shoulders. It's not the end-all be-all of understanding rotation because there's other things that happen there. But with the leg, when my knee is straight, if I turn my toes in, I'm internally rotating. You can see I'm closing off the front of my hip joint. It's a medial rotation, rotating toward the center line of the body. And then I laterally rotate or externally rotate, turning my whole leg, but watching my toes go out to the side, and it opens up that front space in the hip joint, lateral rotation. Okay, so try that. Just see how the ball and socket joint rolls in, comes back to neutral, rolls out. Okay, see if you can visualize the head of the femur rolling in and rolling out. So that way, when you do a pose like tree, you can see, okay, when I come up into tree, I'm starting with a little knee flexion, hip flexion, but then the head of the humerus is rolling laterally. I'm externally rotating my knee as I go up for that pose. But keep in mind, most of the poses that we do are external rotation. When we're doing hero pose and we sit down, I don't like to do this pose a whole lot because the knees can be a little bit sensitive. But if we sit in between the feet, there's a slight internal rotation. Not a real strong stretch, but it's there. But you have to be careful again with creating torque in the knees. Anytime you're doing either external rotation or internal rotation, especially when you're going into a pose that's a deep hip opening, that you're going to hold it for a while, you're trying to relax the muscles, you don't want to have any sensation inside the knee joint, because that's where we have a lot of stabilizing structures. We have ligaments and things in that area that we don't want to stretch and become lax. The muscle belly, feeling it in the muscle, around the muscles that wrap around your hip joint. We have a lot of flesh around that area. That's fine. The knees, not a lot of flesh around there, so we don't want sensation in that area. Be very careful when you're hip opening that your knees are happy with that pose the entire time that you're in it, and notice how you feel when you come out of the pose. If there's any discomfort in your knee, you know that the next time you do that hip opener, you're not going to hold it as long, or you're not going to push yourself as deeply, because we don't want to make the knees angry. All right, so that was our breakdown of the hips, and we'll go over some other poses when I put the practice together of actually working through each of the joints. But next video we're going to go down and do the last few joints. We have the knees, the ankles, and the toes left to go. So thank you for watching, and I'll see you in the next video. Namaste.